Welcome to today's webinar focused on the timely and important topic of children's mental health needs during the current pandemic. We're so glad you could join us. My name is Amy Gohl, the Director of Education for the Partnership for Maternal and Child Health of Northern New Jersey. The partnership is providing today's program. Some brief announcements before we get started. The planners and speakers do not have any relevant conflicts of interest to report. There is no commercial support for this activity. To receive a certificate of completion, you must listen to the entire webinar and complete the evaluation survey, which may be accessed via a link sent to you in an email. You will receive the email at the end of the webinar, about an hour after the webinar is over. Certificates of completion will be sent again by email by August 12th. Today's webinar has been recorded and will be available via the partnership's YouTube channel until August 4th, 2022. And now I'd like to introduce our speakers. Dr. Daphne Anshel is a clinical psychologist in private practice in Hoboken, New Jersey and New York City, where she specializes in the treatment of anxiety disorders, depression, and ADHD in children, adolescents, and adults, in addition to providing consultation to parents and schools in the New York region. Dr. Anshel received her PhD in psychology from the University of California, Berkeley, and completed postdoctoral fellowships at Children's Hospital Oakland and the NYU Child Study Center. She joined the NYU Child Study Center's school-based intervention program in 2003, a program providing clinical interventions to schools evacuated on 9/11, where she provided clinical supervision in addition to consultation to teachers and administrative staff. Dr. Anshel has extensive experience with the treatment of behavioral disorders in children, in addition to the cognitive behavioral treatment of anxiety and mood disorders in children, adolescents, and adults. Our next speaker is Dr. Naama Tokayer, who is a licensed psychologist in practice for 15 years, providing parenting consultation and individual psychotherapy with children, adolescents, and adults. She received her doctoral of psychology in clinical psychology from the Graduate Institute of Professional Psychology at the University of Hartford in Connecticut. Dr. Tokayer has extensive training and developed expertise in the use of cognitive behavioral treatment for the range of anxiety and behavioral disorders and depression. She was formerly the Director of Mental Health Services at New York Foundling Hospital and Project Director of a 9/11 Traumatic Bereavement Program at the NYU Child Study Center in New York City. Dr. Tokayer is licensed in both New Jersey and New York and maintains a private practice in Montclair, New Jersey. Welcome, speakers.
Thank you. Good morning, everybody. Dr. Anshel and I are pleased to be giving this webinar on kids, anxiety, and COVID. The topics we're covering today are based on themes that have emerged in our clinical practices these last few months. While research on the psychological impact of COVID is only beginning to emerge, we can draw from a long history of research on the impact of stress on children and families, and we are pleased to present that to you today. We'll be covering a series of topics, including how stress and traumatic events impact the brain and how it burdens families and community systems. We'll be reviewing how stress on parents reverberates into the home environment and impacts children. And finally, we'll be reviewing the research on resiliency and the practical steps parents and healthcare practitioners can implement that mitigate and impact these stressors. So let's start with a bit of a review about what we know is very stressful and difficult for children and adults during COVID-19. So the first two major stressors that mental health practitioners are identifying are the threats to safety and the unpredictability around that. We know that when people feel or perceive that their safety is threatened, it sets the stage for a traumatic response to that experience. When we think about healthcare professional or all essential workers, we think about that category of that group having a higher proximity to the threat. And so a little bit later, Daphne's going to be talking about the dose impact of exposure to trauma. And so we think of essential workers, and we know that there are people listening today who are essential workers, and we thank you for your work. That when people feel that their safety is threatened in an unpredictable way, then the groundwork is really laid for trauma to potentially occur. Dr. Bessel van der Kolk, a known researcher on the neurobiology of trauma, has talked about COVID as a pre-traumatic condition. The stage is set for trauma, but trauma is not inevitable. And we'll be talking a little bit later about the risks of trauma and how to mitigate that risk through very practical interventions that parents and healthcare workers can take. The research on social isolation pretty clearly states that extreme social isolation really increases the risk for depression and anxiety in children and adults. We know that social isolation is an additional risk factor for children because kids use social contact as practice to develop their social skills. It's a developmental necessity for them. So being in quarantine, being on lockdown has become a safety measure that people need to take, but a risk factor at the same time. Children and adults are experiencing disruption in their structure and routine. For children, we know very clearly that structure and routine really provides a containing, supportive environment for them to safely explore their world. It supports kids' development, and it promotes a sense of safety when there's structure and routine in their lives. And when there's major disruptions in their structure and routine, then we see kids' levels of anxiety begin to rise. Threats to employment and threats to housing are known to be some of the most significant stressors in the lifespan for adults. And then that stressor trickles down to children. And the way that it can trickle down to children is that when parents are worried about their employment, whether they've lost a job, anticipating losing a job, anticipating the possibility of not being able to pay their rent, then that becomes a barrier to being present and attuned to your children and impacts the emotional temperature of the household. So let's move on to the next slide. So Daphne is going to talk a little bit now about post-traumatic stress disorder.
Okay, so thank you, Naama. So Naama's helped set the stage for us to understand how COVID presents a pre-traumatic condition for many of us. When we think about the first criteria for PTSD, It is exposure to a potentially life-threatening event for ourselves, for our loved ones, for an attachment figure, or for someone that we're responsible for. And another very related criteria is a sense of helplessness or lack of control in that context, which is also a risk factor for other related anxiety disorders and depression. And I wanted to share this first slide with you because it can help us understand the basic framework for PTSD. So the first criteria for PTSD is one that I think comes to mind for many of us when we think about the disorder, and that's re-experiencing. We think about flashbacks and we think about nightmares. But there are other forms of re-experiencing that individuals with PTSD or PTSD-related symptoms can experience, such as sensory experiences. Avoidance is another of the pillars and includes things like numbing and dissociation. It can also include things like avoidance of certain places or objects that might be reminders of the traumatic situation that the person had found themselves in. And hypervigilance, when I think of hypervigilance personally, I think of my own experience of moving to New York City 2 weeks after 9/11 to start a postdoc. And a day where I was walking with a classmate, and there was some construction going on, as there often is in New York City, and how my classmate, who had been in New York City at the time of 9/11, was having a startled response to almost every traffic sound and every noise on the street. So when I first moved to New York City, it almost seemed as though all of New York City had PTSD, but of course that wasn't the case. What I was witnessing is very high rates of what we call acute stress disorder. So after a major traumatic event like 9/11 and the amount of exposure that New Yorkers had to that event, many people were showing re-experiencing avoidance and hypervigilance symptoms. But within about 3 months, right, of the event, most of them had a major decrease in symptoms, maybe still some symptoms, but a major decrease. And what that shows is what van der Kolk has been talking about, which is the idea of the pre-traumatic condition, that upon exposure, there's a high risk level. And then various risk and resilience factors may mediate what happens from that point. And as clinicians, we may be a pivot point for patients in terms of them accessing resources that would be preventative of the full development of PTSD and other significant disorders. Okay. Now, on the second slide, where we're reviewing PTSD, we're seeing the current DSM-5 criteria. And I wanted you to see this because what it highlights is some important additional criteria to those 3 pillars that you see with ongoing post-traumatic stress disorder. And that includes changes in cognitive patterns, and that may mean around the traumatic event, but even cognitions about the self and others that become distorted in relation to their PTSD. And also includes functional impairment. So one of the most important questions that we ask as mental health clinicians, we care very much about how much distress people are experiencing. That's important in and of itself. But we also are curious to understand whether the symptoms are leading to functional impairment from that individual's baseline or from what we would expect to see from a person in the stage of life that they are in. And that, of course, is a very important question for us when we're looking at parents who, in this time of COVID, have really no choice but to be primary caregivers to their children. Now, what we saw in our research at NYU is that it was the children with pre-existing vulnerability, the children who had family or community trauma exposure prior to 9/11, or significant psychosocial stressors, or maybe biological risk, who had ongoing functional impairment related to their exposure from being evacuated from their downtown New York City schools. So I had the opportunity to do clinical work with some of the children who were literally picked up by firefighters to be taken out of their schools because they were too little to run. So those children each had their individual life histories, and how much load of risk factors really played a big part in what they looked like psychiatrically post-event. Okay. We also know that the direct amount of exposure that people have to a traumatic event, that there's a dose response to this exposure. So some of the children that we were able to follow really had a very large level of exposure to visual trauma and to experiential trauma as they evacuated their schools. There was actually a very large New York City high school where the high schoolers had to climb over a wall in order to flee from their school near the Brooklyn Bridge. But we also know, that the level of trauma you're exposed to increases risk, but there really is a spectrum of response to trauma. And finally, I wanted to highlight from that research that one of the biggest predictors of children's adjustment post 9/11 and in the years following was their parents' mental health status. And whether their parents met criteria for PTSD or significant depression or anxiety disorder. And of course, a parent who's suffering from those kinds of mental health difficulties is, is understandably more compromised in their ability to do just what Naama was speaking about earlier, which is to be present and to be connected and to be offering up a more hopeful, resilience-based model of life to their children, as opposed to inadvertently sending signals of stress to their children. Now, I'm going to be handing the presentation back over to Naama, and she's going to help us understand the biological underpinnings of PTSD and reactions to trauma.
Thank you, Daphne. So a lot of research over the years that started with research relating to combat-related trauma really helps us to understand what's happening in the brain. The reason why this is important right now for understanding the impact of COVID is that we need to know what is happening in the brain so that we can try to mitigate the impact of that. Now, let's connect the dots between what's happening in the brain when people experience high stress and the body's reaction to that stress. So researchers and clinicians zero in on the limbic system of the brain, which is the structure that deals with emotion and memory. So as psychologists, we're very interested in limbic-based responses and how other parts of the brain, like the prefrontal cortex, interact with the limbic system. The limbic system is responsible for autonomic functions, which are unconscious body functions of like heart rate, respiratory rate, digestion, pupillary responses. So if we think about when the limbic system senses a state of concern, alarm, then people immediately, whether they notice or not, start to experience an increase of heart rate and a shift in their respiratory rates. So the key feature of the limbic system that we're going to be zeroing in on is the amygdala. The amygdala fight, flight, and freeze reactions to stress. It activates this fight, flight reaction when moderate or high stress is perceived, which is important to think about because the way in which the media presented COVID was very clearly as a moderate to high threat, especially to more medically fragile and vulnerable groups in our population. So we were getting all kinds of signals just watching the news, reading the news about a threat to our safety, the safety of our loved ones, and that threat was very high. And so we could say that pretty universally, people experienced a kind of activation of their amygdalas. Some factors that could easily alert the amygdala to activate are those headlines about life-threatening illness and the unpredictability of who will get very sick and die. And that, especially in the early months, there was unclear information about how the virus was being transmitted. And if you remember to our earlier slide, when we think about a threat to safety with unpredictability around that, then the stage is set for a potential traumatic reaction, which is what Dr. Bessel van der Kolk has been talking about. Now, it's important to remember, and we want to stress, that while a traumatic response is vulnerable, it's not inevitable. So the amygdala serves this really important and evolutionary role. Why do we have the amygdala? What's useful about the amygdala? When we think back to evolution and we think about caveman times, it's really the amygdala that prepared human beings to respond adaptively to a confrontation with danger. So imagine in caveman times being confronted by a bear or a lion or another human being with a weapon. It's really critical to react fast. You don't want a reaction to be centered on the prefrontal cortex at that moment. The prefrontal cortex is the thinking, processing, organizing portion of the brain. And so the prefrontal cortex wants to take its time in evaluating whether or not a threat is real. The amygdala needs to jump in a moment like that and get that person to either fight back on the stressor or threat or get away really quickly. And so it activates all those autonomic responses. So if we think about a modern day example, we're not living in caveman times anymore. Try to imagine yourself walking close to train tracks, maybe needing to cross the street and you need to cross over a train tracks. And right as you're approaching those tracks, you hear a loud whistle of the train. In that moment, the overwhelming majority of individuals are going to experience the amygdala's response. They're just going to run. It's not going to be a response of, let me stop and think about, what does that whistle sound like? Well, hey, it kind of sounds like a train. If we stop to take the time to evaluate the threat, that could be life-threatening. We could lose our life as we evaluate that. So the amygdala has a really important function and role. But when it gets activated and overactivated and repeatedly activated, we can experience what Daniel Goleman in his book, Emotional Intelligence, has called a limbic hijack. So a limbic hijack is when the prefrontal cortex is momentarily or more than momentarily inhibited because the amygdala is on alert. It's a short-term reaction. For some people who have PTSD, limbic hijack occurs for longer periods of time. If you think about these states of awareness and information processing, being able to work on tasks, helping your child with online schooling, managing home, your work, and solving problems, which is what parents are facing today. Parents have to deal with managing their household, dealing with potential threats to their job, helping their children with online schooling, being reassuring and validating with their kids. All of those tasks are incompatible with having an activated amygdala. And that is the stress that parents have been facing since March, right? Is to be able to be attuned to your child, but not really being able to do that very successfully when you are in a state of high alert. So I'm going to turn the slides over to Daphne now, who's going to talk about the impact on parents and communities when the emotional temperature in the household is high and how that impacts children.
So, when we hear the phrase, it takes a village to raise a child, I think it's really relatable for most of us, right? So when we see a family system that's functioning well, we don't always know exactly what the key pieces are that help that system function well. And sometimes a single change, like a lack of regular childcare from a grandparent or a disabled parent, or change in health status or employment, can shift a functioning family to being at risk. And it's really the village, right? Neighbors, other extended family, and community members, after school programs that come in to help and provide support at times of distress or crisis for a family. And we can see immediately how the village functions is being severely compromised by the COVID crisis. So when you first have contact with a family, it's a good idea to have a listening ear as to what aspect of the family's village has been disrupted by COVID and what resilience and risk factors currently exist for the family due to the restrictions of social distancing. Now, all development occurs in context. So when we're assessing children's mental health, we're not only assessing their individual characteristics, but also the family system and community systems that they're embedded in and that provide support and developmental opportunities. And COVID has a major impact on these systems, placing the major burden upon the nuclear family system. So we're going to take a moment right now to think about all of this from a developmental context. Okay, so a half a century ago, the field of clinical psychology and psychiatry really thought about children in two separate ways. They thought about typical development and what were the stages of cognitive and social development within that. And then they thought about children with maladjustment, and they thought about psychopathology. Well, at some point mid-century, particularly after World War II, researchers began to ask themselves, in what context do we see the development of psychopathology? And one of the earlier models of this, you see here on this slide, Bronfenbrenner's ecological systems theory. And here what we see are the systems that surround a child, the context of development. And what we see is, while the child, of course, has their microsystem, and that does include both nuclear family and school and their very immediate environment, there are other systems which have a big impact on development, including their community functioning, including things like pollution or lead exposure, including the social and cultural values, both of the immediate community and shifts in the larger culture over time. Okay, and what we can understand looking at this model again is how much pressure is being placed upon the family system and upon attachment figures to provide the environment that the child is growing and developing. And it's happening when those attachment figures are overloaded themselves due to the COVID crisis. Okay, I'm now going to be turning over the presentation back to Naama because we want to highlight some of the important stress indicators in children to look out for.
Thank you, Daphne. So it's important to think about stress indicators in children. I'd like to take a look at the next slide. So when we think about evaluating whether a child is stressed, we always start by thinking about what their baseline was. So when an event occurs that is stressful or potentially traumatic, we go back to what the child experienced and exhibited before the stress factor. So an important question when a parent calls to say, I think my child is struggling with COVID, or I think my child is struggling with a reaction to anything, is to really take a bit of a history and to understand what that child was exhibiting before. And so when we look for their behavioral patterns, children express themselves more behaviorally than they do verbally. And as they get older, then they're able to use words and language more as the language centers of their brain continue to develop. But until that point, we see behavioral indicators of stress. So for children, it might be challenging behavior, clingy behavior, and we want to know, is that a change? Is that a shift? Was your child responsive to limits and rules and expectations, and now that has changed? Did your child always struggle with responding to limits, rules, and expectations, but now the situation might be worse? So that's a really important question to ask and to think about when you're meeting with parents or a child. Another stress indicator that we look for is milestone regression. If a child was previously toilet trained, sleeping through the night, verbally expressive, and then all of a sudden that child is wetting the bed at night or during the day, or seeming to regress in their milestones, that's a pretty classic indicator of stress and an indicator that the child might need some support. So changes in sleeping patterns, so children that are waking up in middle of the night or having trouble going to sleep. So we look at sleep and eating patterns as other indicators of stress in children. I can say that in my own personal family, I noticed that my son was coming to check in before going to sleep several times after COVID, or he had previously gone to sleep pretty smoothly and easily. Now I noticed in the first month that he was coming to just kind of share some story or anecdote from the day, but the underlying message that I saw was that he was needing and craving some reassurance before bed. Trouble with academic focus, that's been a major complaint that I'm hearing from parents, is that it's difficult to focus with online learning. That's a major platform shift in educational models today. And so it's something that we want to be attuned to as parents and healthcare providers around how difficult it is for children to focus. Is that just a function of online learning, or could there be something more going on with a shift in focus in general? When we think about anxiety, we think about anxiety as an inhibitor and a barrier to focus. lots of kids, when they come into our offices, can present as if they have ADHD. They seem poorly focused, a little bit impulsive, and part of the role of a child therapist is to do an initial screen and evaluation on what is the barrier to their focus. Is it a true bona fide executive function barrier that could be related to ADHD? Or is there an underlying anxiety, possibly mood, depression, that is interfering with their ability to focus? Somatic symptoms and complaints are very, very common complaints that healthcare providers hear from children. Pain is the most common somatic symptom. You hear kids who are stressed talk about headaches, stomach aches, sometimes random pain complaints. It's important for healthcare providers to screen for a medical reason for the pain. And if medical reasons are largely ruled out, then we really tune in to that child's emotional functioning and whether the pain complaint could be a red flag for stress. Cognitive behavioral therapy has been really useful in developing effective interventions and helping children to differentiate between their kinds of thinking. And so we know that people that have somatic complaints tend to overgeneralize or catastrophize some kind of physiological cue. If they have a headache or a stomach ache, then they might conclude something catastrophic, and that leads to ongoing physical symptoms. But in cognitive behavioral therapy, if we can help them to identify that they might be having a catastrophic thought that might not have a lot of evidence to support it, then it can help them to regulate their thinking and inhibit that domino effect that happens between our thinking and our emotional responses. Catastrophic thinking is another indicator of stress and anxiety in children. So we hear sometimes kids with catastrophic thinking worry that every time it rains, that a tree is going to fall down directly over the roof of their bedroom. They have very intense catastrophic thoughts. That's often associated with separation anxiety, but other forms of anxiety as well. And so that is a red flag when you're evaluating a child in your office, that is likely a child that is experiencing some form of anxiety. So not every child that experiences stress and anxiety needs to be in therapy, needs to be working with a therapist. We'd like to talk to you about parenting strategies that you as healthcare and mental health professionals can coach parents in doing. And so when we look at the list of parenting strategies, we have to keep in mind that image of the oxygen mask that we learn about before we take off on a plane. So that oxygen mask analogy is that if you don't take care of yourself first, you're in a weak position to take care of your child. That is something that Daphne is going to be talking about in greater detail a little bit later in our presentation around practical steps to take care of yourself. But that's a really important filter to have in mind when we think about parenting strategies, is that we as parents are going to be more effective in parenting strategies and helping our children find their calm if we work on finding our own calm and regulating our own emotions, which is very difficult to do right now. So let's talk about the first really important parenting strategy that is not unique to COVID, that is important at all times in our children's lives and development, and that is the strategy of validation. Validation means that we signal to our children that we understand and are listening and get what they're feeling. It does not mean that we have to agree with what they want, give them what they want, or give in to something that they're asking for that might not be reasonable. It simply means that we show them that we see how they're feeling and we help them name how they're feeling. In earlier psychological literature, that was sometimes called mirroring. So an example of validation is when you hear your child express concern about COVID, express frustration with their sibling, express that they hate schoolwork. We don't have to immediately rush in and say, you're right, your sibling was being unreasonable, or you don't have to do your homework. We simply say, we get it. We see how frustrating this is. We see how scared you feel. I'm here. I can listen and talk. I'm here for a hug. Simply showing them that you see them in that moment and you see their emotions and you name them and you understand their emotion and that their emotions are true and valid and reasonable is so essential for children to be able to then regulate their own emotions. Human beings have a much easier time managing their emotional responses when they feel understood by other people. So another important parenting strategy is managing the signals we give to our children about anxiety and danger. That basically means that we need to keep ourselves in check. We shouldn't be overly reviewing the dangers, and we should be thoughtful and giving our children age-appropriate facts and information without alarming them. I can think of a personal example in the first 2 weeks of COVID where I think I violated that strategy. I was outside with my son. This was before we really knew about how the virus was transmitted. He was riding his bike. I was right behind him, and someone was walking towards us. And that person did not cross the street. No one was wearing a mask at that time. And I gently tried to tell my son to turn his bike so that we can go around the corner. We were right by a corner. He didn't hear me. And as the person across the street got closer to us, I really raised my voice in a way that signaled alarm to my son about that other person's presence being dangerous. I recognized that immediately after I did that and talked to him about it. But I think we all have been doing a lot of that, especially in the beginning weeks. That does not mean that we can't repair and we can't have do-overs. We need to be communicating with our children what's happening. But over-communication or alarming communication is what we should be reining in. We need to be implementing structure and routines for our kids. That's really important to help them contain their own anxiety. It makes their lives predictable when they know that they're having a meal at about the same time every day, when they're having bedtime at about the same time, when they get to use technology at certain times of the day. When they have some predictability around that, then it's very containing and reassuring for children. We need to be keeping the temperature low with our partners at home. Now's not a time to be dealing with long-standing issues in our relationships. It's okay to put some of those tense issues on the back burner so that the home environment can be calm with a low emotional temperature. Conveying calm is really important to acknowledge that there's concern around the virus and we need to take action, but communicating that the actions that we're taking around mask wearing is to ensure safety, that there's something productive in the steps that we're taking towards some social isolation and mask wearing. Managing exposure to news media is something that Daphne is going to be talking about a little bit later. We certainly know we want to be informed, we should be informed, and we should be informed with facts. But when the news media is on repeat throughout the day, then it creates a higher temperature. It creates the opportunity for limbic hijack, and then that decreases the likelihood of communicating and conveying calm to our children. So being informed, but managing how much news we're watching. Daphne's going to talk a little bit later about what the research shows about exposure to news media in times of crisis. We'd like to talk to you about resiliency and what we know. Meichenbaum has done tremendous research on what are the factors that promote resiliency in individuals and in children. Resiliency is defined by the ability to cope with stress and adversity. And there are key factors that we consider the building blocks of resiliency. Our ability as human beings to form and maintain close relationships is an important ingredient for resiliency. That basically means that having people that we are connected with, whether it's family members, a few close friendships, it does not mean that we have to be extroverted in order to be resilient. But we need to have a select group of people that we can talk to and feel close to. Those are the people that we are going to share our true feelings with and get validation from, which is why it's really important for parents to be supporting and facilitating social contact for their children safely. So that might mean that we help our children engage in Zoom or FaceTime get-togethers with friends, or outdoor meetups with masks if parents are comfortable with that, including 6 feet of social distance. But for children to be able to maintain their connections with their friends during times of quarantine is actually essential for them to be able to engage their resiliency. Being able to communicate our emotions is a significant resiliency factor. So people that are able to talk about their feelings honestly tend to be people who have stronger resiliency. Personal control basically means that we have the ability to regulate our emotions and behavior. We're not losing control at every moment of frustration. People that are able to manage their reactions tend to be people with stronger resiliency. Being able to lean into positive emotions is a key resiliency factor. So that basically means being able to recognize that there are some positives, even though there's stress right now. So being able to recognize that this situation with COVID does not completely inhibit our opportunity for positive emotions. Recognizing and leaning into factors that promote our positive experiences is really important. People that focus in on negative emotions and get stuck in their emotions without being able to extract themselves from that experience tend to be people at higher risk during these times. Cognitive flexibility is really important. No one expected a pandemic. Being able to shift our lifestyles in response with some flexibility, as opposed to people that are completely shutting down, is really important to think about in terms of resiliency. People that have capacity to go with the flow are people that tend to be more resilient. Leaning in to activities that reflect our values. So if your values were surrounded with volunteer work, well, let's have some flexibility. You can still volunteer, but it might need to look a little bit different right now. It could be values of being a good friend. And so what could that look like right now? This is a really important time to remind yourself and remind your children that even in times of stress, growth can be part of the outcome. Yes, we need to validate that this is a difficult time for all human beings, but that there's things that we can learn from them. Some people might be very aware of ways in which they're learning right now, or some people might be talking about things that they might learn in the future. One thing that I have appreciated is not feeling subject to jump into my car every 5 minutes on the weekend. That what the food that we have in the house is what we're going to creatively make dinner with. And that has been an area of growth, to feel like I can spend some time on the weekend being focused and attuned, despite the anxiety that I experience about the future. Daphne is going to talk with you now about the self-care that is essential for parents to engage in order to be supportive to their children.
Thank you, Naama. So as Naama was talking about, even though we are all practicing social distancing, social support is actually more important. And it could take different forms depending on the communities we're in and what kinds of social distancing are necessary. And this may change from month to month. But the ability to have interaction with peers, so for the parents that you might be seeing, fellow parents, to have interaction with family, to have interaction with those individuals who really feed the person emotionally. And a big piece we can ask ourselves as clinicians when we're speaking with an adult is to have a sense whether they've been able to sustain sources of social support, whether their social support networks were actually a little bit thin prior to COVID, or whether they in fact have found the kind of resilience Naama was speaking about and found ways to do a FaceTime dinner. I know of a case of girlfriends from college doing a FaceTime tea together. This is a particular parent in my practice who the dad actually called me because he was concerned about his wife. And I've had a long-term relationship with the family. And so I had a session with mom. And by the time I had a session with her, she'd really already found some new sources of resilience in the form of these, Zoom or FaceTime connections with friends. But for those adults that we see where, the social supports were not flowing for them, there are likely reasons, prior mental health factors or social cultural factors that blocked that. And if we're seeing them be symptomatic, that's when we may want to think towards a psychotherapy referral. Now, one thing that we can be, encouraging our patients, our friends, and we can be encouraging ourselves to do right now is engaging in stress reduction. So Naama and I have spent a lot of time outlining the sympathetic nervous response in the body, right? Response to stress, response to trauma. But by the same token, we also have the parasympathetic nervous system, which is really the relaxation response in the body. The gateway to that response is available even in these times of COVID. And it can be as simple as slow breathing for a few minutes and having that be a daily ritual. But ideally, it would include physical exercise. It would include time in nature. I live in a more urban environment, and I can tell you that I know the flowers and trees in the 10-block radius to my house better than I ever knew them before COVID. It can include more formal mindful practice or religious practice. And it can also include yoga. And we're highlighting yoga here because there's now a good decade or more of research supporting that yoga is therapeutic for people with a variety of anxiety disorders, therapeutic for people with depression, but particularly therapeutic for people who have undergone trauma or who actually have PTSD. So Bester van der Kolk, who was mentioned before, some of his initial research was on veterans coming back from the Afghan war and Iraq war. So individuals who'd undergone really severe and repeated trauma. Why would yoga be helpful? It is about being in the moment without judgment. It is about being present to one's body. And part of the stress response in the body are things like muscle tension. And having more body awareness is helpful and engagement of muscles actually can help them release. In addition, yoga has another interesting aspect that in doing these poses that are over 1,000 years old, some of them may feel familiar and very relaxing, and finding that parasympathetic response is easy. But as someone evolves in their practice, there are bound to be poses that strangely feel uncomfortable. And when I'm talking uncomfortable, I'm not talking physically uncomfortable. I'm talking about bringing up some kind of negative emotional experience, a sense of emotional restlessness. And learning to tolerate discomfort and breathe through discomfort is one of the biggest resilience building factors that we have for ourselves and for our patients. Naama spoke before to creating family routine and structure. We also have decades of research to show that families who are stronger on ritual, like the Friday night or Sunday night dinner, the get together with extended family on Sundays, certain kinds of birthday and holiday traditions, and who really hold to those traditions. The children in those families show better adjustment. It speaks to some of the predictability that Naama was speaking about before, but it also speaks to the emphasis on connection, the valuing of connection within the family. Okay, so I wanted to highlight just a few ideas that are more cognitive therapy oriented for the adults and the parents and caretakers that you might be interacting with. So one really important issue is, can an individual recognize when their thinking is influenced in an outsized way by their emotional state? There's a very big difference between someone who is in their emotions and someone who's able to have meta-awareness about that. And of course, as you saw from Naama's slides, part of the way the brain works is when when the amygdala and the limbic system are very activated, it does shut down the prefrontal cortex. But if we have some meta thinking, that helps us understand that when we're in a stronger emotional state, that we are not able to think as well, then we can engage in some of those stress reduction activities just to bring the emotional temperature down a bit. When we are more stressed, we think in more black and white ways, which is not helpful in these times of COVID. So to piggyback on Naama's example, you know, if I think to myself, there's this specific traditional dinner that I make for this birthday, and I've made it, you know, every year for 10 years. Well, maybe at the time of COVID, it's not worth the extra grocery trip or that extra exposure, and to be thinking more creatively and out of the box. People who are more stressed tend to then have more negative automatic thoughts about themselves, others, in the world. And their ability to have meta awareness around that and to catch those thoughts is critical to their mental health. And then, of course, it's very key to understand when we make behavioral choices that contribute to negative emotional states. So for those of us, you know, in those early days, right, where news was pouring in about COVID, we may have stayed up just a bit too late looking at our Facebook feed or media feeds. And how are we feeling the next morning when we haven't gotten enough sleep? Just simple choices like that actually really make a difference, especially to our bandwidth to be caretakers to others. Okay, so I want to shift for a moment and talk a bit about media exposure. Naama and I wanted to make sure to highlight this because a very important takeaway from the last 30 years of research is that there is a big impact of media exposure of traumatic events on children's mental health. So Lenore Terr and her colleagues followed a large cohort of children who were exposed to media coverage back in 1986 after the Challenger explosion. And what they found is that 14 months after the Challenger explosion, 60% of children were showing at least one trauma-related symptom. And this is just from TV exposure. I actually remember it myself because I was in high school at the time. And I guess, I don't know, my social studies teacher probably turned on the news. So I have a memory of being an older child myself and exposed to this. You know, you have this baseline of a sense of safety, right? That this kind of human endeavor is safe. And then there's this very potent image of how it's anything but. Researchers have also looked at the impact of other traumatic events reported in the media, such as natural disasters and terrorist events, and they've shown very parallel findings to Lenore Terr's original research. And after the 9/11 attacks, researchers found that children who were significantly exposed to DV news had a 5% chance of exhibiting the full spectrum of PTSD symptoms related to this exposure. And so, you know, in 1986, there was fewer kinds of media exposure, if you think about it. And by 2001, there were even more means of media exposure. And those children who were most highly exposed, had the most hours of exposure, showed the most symptoms. And this was particularly true for preschool age children who don't even have the cognitive processes to parse out and fully understand and mediate their emotional reactions to what they're viewing. And so it's important to understand that while we're not exactly experiencing a trauma when we watch something on TV news or even on something like a media feed on the internet, it is still exposure. And that's not only true for our kids, it's true for us as well. Okay, so we wanted to give you a little bit of a taste of what child therapy looks like because one of your roles may be referring. And so when I walked into my new supervisor's office shortly after 9/11, one of the first things I noticed posted on his wall was this adorable picture drawn by a child with the slogan, "When you have sour lemons, make lemonade." And Now, it's not only super cute, but there's actually a lot in this metaphor, which is why we use it so often in child therapy. It's relatable to kids, but it's also an inroad to identifying a cognitive shift from a more helpless and hopeless cognitive style to one that includes what we call coping thoughts. So it's interesting to think about how this simple idea highlights some of the things that Naama was speaking about before. There's validation. Yeah, you have some sour lemons. You do have a bit of a sour deal. And it also highlights cognitive flexibility and problem solving and making use of resources that you have access to. And I think it's a bit of a funny example right now. I think the COVID example would include baking products and having to like replace whole wheat flour with like almond flour because that's what there is in the store, right? To make your family recipe. Okay, so we wanted to emphasize, you know, the usefulness of child therapy because of your role as referring clinicians, and also because we wanted to make sure to highlight that as clinicians ourselves, we've been doing exclusively teletherapy since social distancing began in the Northeast. And we know that it is effective. So what we want to highlight are some of the bigger red flags to look out for. A parent reporting suicidal thoughts, of course, their own or their child's, or a child reporting suicidal or self-harming thoughts. It takes a while to evaluate the level of risk in these situations, and it's most certainly informing of the level of distress that that individual is experiencing, and also the level of emotion regulation difficulties that they may be experiencing. Also, significant behavioral changes, as Naama mentioned before, in the child that are persistent, need to be really addressed and are warranting of a referral. High levels of parental stress related to their child's behavior is also an important reason to refer. You have greater risk of emotional and physical abuse, but even if those issues are not relevant, certainly it indicates that the whole family system is highly stressed, and that social supports could make a very big difference for that family. Okay. So here I have a slide just to give you another kind of sense of how we make child therapy as friendly as possible, but also interweave those elements of cognitive therapy that are more structured, helping children have a playful way of writing about their coping statements to the challenges in their life. Okay, children and adolescents can also engage in stress management. So we wanted to highlight apps such as Headspace and Go Noodle and Calm because they can support learning the deep breathing, the mindfulness and yoga, and also help children continue to exercise even when they may be on partial lockdown or have limitation to things like playground or group activities. Children can learn mindfulness and they can participate in yoga from very young ages. Mindfulness is really a birthright, and our job as caretakers is to help children have access to that. Children, like us adults, really benefit from time in nature, exploratory time in nature, or just taking a walk with a parent. As Naama spoke about before, children and teens need social support just like adults. It can be in the form of virtual contact with peers or carefully social distance contact. They need contact with extended family and friends. And when they're showing significant stress, teletherapy is really an important option to consider. And so we're hoping that you can take the information that we share today and have some concrete suggestions and tips for the families that you interact with. I think that I should hand it over to Amy, because I have a feeling we're over time.
Thank you so much, Naama and Daphne, for that wonderful presentation. We just have time for a few questions. The first one is, what emotional reactions do you expect to see in children when it's time to return to school?
I'll respond to that. So again, it goes back to the question of your child's functioning and well-being before COVID. If your child has a history of anxiety, then that is something that should be on your radar. But what I would expect to see from most children is some spikes in anxiety about the return to school. Kids have been very eager to get back into school, to feel a sense of normalcy. But what they might not be expecting is to feel that rise in anxiety having to do with all the signals that we've been giving them the last 4 or 5 months. We've been signaling to them that being around people is a little bit dangerous. And so we're expecting that while kids now want to go back to school, when it comes time to actually return to school, that they're going to start to express some hesitation, some worry. Parents might notice difficulty sleeping, shifts in appetite, some clingy behavior. And so what we recommend is a little bit of what we would call exposure. And exposure is getting close to whatever it is that makes you nervous. It basically means to face your fear. No human being in the world overcomes their fear without facing it. And so what exposure can look like for children as they begin to return to school is it might be a few trips to the school building before school actually starts. So I would recommend that parents walk or drive to the school building, maybe sit on the front steps and have lunch there. Get used to, allow your brain to habituate to being near the building. It might mean exposure to social contact again. If you're a family that has been only doing online virtual social contact, then it might be time to engage in some exposure to being around other children safely. It might mean going out more to regions where there are more people, because that allows the brain to habituate, or more simply put, get used to the experience again.
Thank you. And just one last question. What do you say to totally overwhelmed parents?
Yeah, I think that's a really good question. There's a whole range of families, right, that we all might be having contact with in different ways. And I think a helpful rubric is thinking about a hierarchy of needs. You know, when you take intro psych, that's one of the first concepts, like Maslow's hierarchy of needs, right? And to remember that we can't be thinking about these more subtle emotional issues when there's insecure housing, when there's food insecurity. We need, and also I think if you're talking to an individual in that situation, it could be very inadvertently invalidating to go to some of these more subtle issues. And so the validation alone, if we can help in connecting to resources, remember that hierarchy of needs is really the bedrock, right? I know for myself that I couldn't parent, well, in a situation where those kinds of basic human needs were uncertain, right? And so that's the bedrock. And for a lot of families, they will stabilize if they have that bedrock, right? There's a lot of resilience in human beings. And for us to keep that in mind, and to remember that for some parents, there may be some pride actually when interacting with a clinician in terms of even admitting that there are those kinds of economic vulnerabilities. And of course, to keep in mind that it's not as easy for family or friends, close friends, to take people in because of the need for social distancing and, having elderly or other at-risk individuals in households that need to be protected. So we need to keep those things in mind.
Thank you so much for your well thought out and thorough responses. That's really all we have time for today. Again, I want to thank both Daphne and Naama for being with us today. I'd also like to thank Monica Smith, who provided our technical support. A reminder to those who are listening to be on the lookout for an email, which will arrive in about an hour. This email contains the link to the post-program evaluation. Certificates of completion will be sent next week to the email address you provide in the evaluation. We hope you can join us for our upcoming World Breastfeeding Week webinars, as well as our perinatal depression update for health professionals, which will round out the month of August. A calendar of the partnership's upcoming virtual programs and links to registration can be found on our website at www.partnershipmch.org under the Professional Education tab. We also offer on-demand recordings of many of our programs, which are listed there as well. Thank you for joining us for today's program.